okay? So if you call 911 and you're in the Inland Empire, you just might get saved by her. So this series is to highlight the value of EMS, okay? Firefighters, EMTs, paramedics. So if you want to be ER or trauma nurse, they're going to be bringing you your patients, okay? So I want to highlight them to say, first of all, thank you. And second of all, we have a lot to learn from them. So this video is going to be about the rapid trauma assessment that we're going to go through right now.
Hi, this is Alyssa, one of my top EMR students, who's going to be highlighting the rapid trauma assessment. I completely have faith in her assessment, and like I said, she's one of my top students, and she's going to showcase what she has learned over the semester.
Alright, so before we start the rapid trauma assessment, there are certain acronyms that we do use, and we just go through them super quickly in the assessment, but you'll need to know what they mean before I just start saying random letters. So first we have what's called DCAT-BTLS, and you do this on each section of the body as you're assessing it. So that stands for deformities, contusions, abrasions, penetrations, burns, tenderness, lacerations, and swelling. So you're just going to be looking for each of these over every single section of the body. And then while we're assessing the abdomen area, we have to check the tenderness, rigidity, evisceration, distension, guarding, hot belly, or a pulsating mass. So you're just checking those as you are palpating and just looking at the abdomen. Alright, and there is also another acronym that we use, it's called TIC, so it stands for tenderness, instability, and crepitus, and it's used to palpate for any broken bones or any fractures, anything on the body. So you're going to do that throughout the whole body except for the abdomen, because since the abdomen doesn't have any bones in there, that's why you're going to use the TRED GHP. Alright, so here we have one of the dummies that we're going to be doing the rapid trauma assessment on. So when you're entering your scene, you're always going to make sure that you are prepared and that you are protected from any hazards. So you're going to put on your gloves and everything. It's called BSI, so body substance isolation. And then you're going to approach the patient, you're going to get a general impression of the situation. So here we just have a female lying on her back on the floor. And then after that, we're going to approach the patient from the feet. We don't want to approach from the head because in case they do have a spinal or neck injury, they're going to be turning their head to look at you and it might mess things up even more. So we would approach from the feet, and then you're going to delegate someone to hold their neck. That way it's stable and they don't mess things up even more than they already are. So Ms. Comet, she's going to hold what's called C-spine on the neck. Alright, and then we will determine if the patient is a load and go, stay or play. So if we need to get them in the ambulance and out of here, or if we can kind of just assess the patient if they have a little problem and just solve it right here and then they're fine. Alright, next we're going to be doing the primary assessment to see if we have any life or death injuries going on here. So we're going to start with the acronym ABCs. So A stands for airway, and you're going to check and make sure that their airway is open, clear, maintainable, no need for suction, and no need for adjunct. After you have all of that determined, you're going to do B, which stands for breathing. So you're going to check their lung sounds. So you're going to auscultate for the lung sounds. And then you're going to make sure that the lungs are, you're going to check for the rate, depth, ease of the breathing, and if they have any need for oxygen with a nasal cannula, a BBM, or anything like that. Next is C. So C stands for circulation. You're going to check for any apparent bleeding outside. You're going to check for the pulse, so you're going to check the radial artery and the carotid artery at the same time. Then you're going to check for skin signs, so are they pale, are they sweaty, are they hot to the touch, or anything like that. And you're also going to check for their capillary refill and see if it's immediate on their fingertips. Alright, so now we're going to start the rapid trauma head-to-toe assessment. So this would be useful for any student nurses or new grads who are looking for a trauma assessment very quickly for a patient. Alright, so we're going to start from the top of the head and go all the way down to the toes and then come back up for something else. So starting with the top of the head, we're always going to check for DCAT-BTLS, if you remember that from earlier. And then you're going to palpate the skull by running your fingers just along the back of it like that. Next, you're going to check DCAT-BTLS on the face, and you're also going to palpate for any broken bones along the face. You're going to check for any liquid, such as blood or maybe even brain fluid coming out of the eyes, nose, mouth, and ears. Next, you're going to check the neck, DCAT-BTLS, and you're going to check for what we use as 1, 2, 3, 4, 5. So for 1, you're going to check and see if they have a stoma or a scar from a previous stoma. 2, you're going to check for jugular vein distension. 3, you're going to check for tracheal deviation, if it's deviating towards one lung. 4, you're going to see if they have any medical tags on their body. and 5, you're going to check for subcutaneous emphysema along your chest. Alright, and then on the back of the neck, we run our fingers along the back and kind of just go like this down the neck. And you're going to check for step off, spinal alignment, blood on gloves, or point tenderness. So after you get the neck, you're going to get the collar. You're going to measure it with your 4 fingers like this from their neck down to their shoulder. This one's got a big neck. Alright, and then you're going to take the side that doesn't have the Velcro strap and you're just going to put it under their neck. You're going to kind of have to work around your person who is holding C-spine, but it'll be fun. Then you're also going to palpate the chest, but you can't just push down on the chest because if it's a female, then you might get sued for doing that. So what you're going to do is you're going to palpate using your forearm, and you're going to go anterior to posterior. Take your 2 hands, put on the sides on the mid-axillary line, and do lateral to medial. Just seeing if the rib cage moves or anything, because if it does, then that is definitely broken ribs. Lung sounds, so you're going to auscultate for the lung sounds when you're on the chest, and you're going to do on the mid-axillary point on each side. Do the decat BTLS on the abdomen, and then you would palpate, so you imagine just 4 quadrants on the abdomen and palpate once in each of those 4 quadrants. And then again, you would check for the TRED-GHP, which is the acronym that we went through earlier, see if any organs are hanging out, if anything's wrong with their organs right there. Next, you would move down to the pelvis area, so decat BTLS, and then you would palpate for the pelvis as well. You're going to take your 2 hands, do anterior to posterior, and then lateral to medial. And then you would want to check for any fluid coming out, if there's any blood or anything from a female or a male. But specifically on the male, you would check for priapism, which is an erection that they can get from spinal damage. Alright, so next on the legs, we're going to do decat BTLS again, and then you're going to palpate using offset pressure, see if they have any broken bones on the legs. So you just palpate on the thighs, the calves, the thigh, and the calf again. Next, you would do the feet, so decat BTLS again, and then you're going to do the pulse at the same time, once on each foot. Then once we're done with the feet, we're going to go back up to the arms. Decat BTLS on each of the arms. And again, you're going to palpate with offset pressure. So you're going to do the forearm, bottom arm, there, and there again. Then you're going to get the hands, do decat BTLS on the hands, each of them, and then you're going to check for the 2 pulses at the same time again. And make sure that they match up. Alright, and when you are checking the pulse on the feet and the hands, you're going to check for what is called PMSCs. So you're going to check for the pulse, you're going to see motor, sensory, and circulation. So you're going to ask them, can you wiggle your toes, can you wiggle your fingers? You're going to grab one of them and say, like, which toe am I pulling? And then as you release it, you're going to check and see for the capillary refill one more time. Alright, and to finish up the assessment, you're going to log roll the patient over, check everything on their spine for what we just checked on their front. So you're going to grab the shoulder and their hip, and on the head person's count of 3, you're going to flip them over.
1, 2, 3.
Alright, so with one hand, you're going to hold the patient, and then you're going to do decat BTLS on the spine, and you're going to just walk your fingers down the spine, feeling everything. You're going to be checking for that spinal alignment, step off, tenderness, or blood on gloves. So pretty much as you pull your hand away, you're going to look and see if there's any blood on your gloves left. So after that, we would be going into the C-spine. So we would move that leg. We're going to pull this board over to the patient, make it line up pretty much right on their back so I can just flip over onto it. And then again, on the count of 3, you're going to flip them over.
1, 2.
Almost centered. Alright, so then to get the patient pretty much lined up centered on the board, you're going to do a Z-track. So you're going to grab their hips while this person is grabbing their shoulders, and you're going to move it up and down in a Z-track motion.
1, 2, 3.
Alright, so now we're going to be putting them on the C-spine board. So this is really important to maintain the spinal immobilization, because if they really do have any spinal damage, we don't want them to be moving around. We don't want any possible movement coming from their spine in case it could damage it even more. So we're going to start by strapping them onto the board. So we have this strap underneath them already. We already have their C-collar on, so we're just going to strap with the abdomen first, then we go to the head, and then we go finish with the legs. Alright, so now we're almost finished with the abdomen, and when you're putting it through this D-ring here, you're going to want to make sure you do the feed and pull method because you don't want to be yanking on the strap, moving their spine around all over the place. Alright, so you're going to be feeding the strap like that with your hand and pulling with the other hand, making sure not to yank on anything. Alright, and you do want the strap to be nice and tight to make sure that they can't move anywhere. But if you do end up with the D-ring in the center of the chest when you're done with everything, you don't want that because in case they do go into cardiac arrest and you're going to need to do any compressions on them, that's going to be right in the way of where you're going to need to do it. So you're going to have to kind of adjust things, move them around to make sure that the D-ring ends up pretty much right above the shoulder right here.
Okay, so all my student nurses and new grads, this is how you will be receiving the patient in the ER or in trauma. And so this video will just help you have an appreciation for our EMS crews for all their efforts to save the patient prior to us receiving them in the hospital.
Oh. Velcro's on the wrong side. Yeah. Alright, so now we have the head strapped down to the board, so we're going to make sure to strap the legs onto the board now. And the C-spine person can now let go of the C-spine because their neck is already secured. So you're going to be starting on the hips, pretty much right below where the previous strap is for the abdomen. And while you're doing this, you're always going to want to make sure that all of these straps are completely flat. There's no twists in them, no folds or anything. And you're going to go down as far as possible as you can onto the board. So here that would be onto the last little hole in the board there. Oh, it's attached. No, I didn't do that one right. Mm-hmm. I did? Yep. And again, use the feed and pull method to make sure you don't yank on their legs because you don't really know what kind of injuries are inside, so you don't want to yank them.